Okay, good evening, doctors, once again. And we are starting with the cardiology topic. Before that, what we want to know is that we are looking for the entire topic. What are the topic has to be studied for the DH examination or other prometric examination? I'm giving in a general idea, only the name of the topic I am giving at first. We will follow in this manner. First of all, you can see, first and foremost thing is internal medicine. Internal medicine, most questions are asking from internal medicine, in which several chapters are there: cardiology, endocrinology, GIT, and just wait, hematology, nephrology, respiratory system, rheumatology, neurology, and infectious disease. We may not follow this order because last batch has also some respiratory system and neurology infectious disease they have to complete. So we will first we will deal with the respiratory system tomorrow. After completion of cardiology, we will deal with the respiratory system, neurology, infectious disease, etc. Anyway, we will complete all these internal medicine topics at first. Then, just wait, we will move to general surgery. General surgery also has a role, including orthopedics. More than that, obstetrics and gynecology, pediatrics, and psychiatry also. Okay. And more than that, ophthalmology, ENT, dermatology, family medicine, and little bit of statistics ideas. Beyond that, some examination prometric may ask for ethics also. We have to deal with, in case if we get time, we will deal with ethics. So family medicine statistics, dermatology, ENT, ophthalmology. These are one day's record for all these things. Now psychiatry, pediatrics, obstetrics and gynecology, and general surgery, internal medicine. We want to know what are the topic asking for that. I have referred the last question paper and found that we are presenting the content in which most of the questions are from our material. So material means PowerPoint presentation. Okay, let me start with the cardiology. That does not mean you have to exclusively follow my material. You have to study as much as you can possible. Okay, now let me in the cardiovascular system. Okay, as one person is here, do you prefer an interactive session or you are observing, simply watching and observing, which you prefer? Asking questions and answering, or you are simply watching the class, which you prefer now?
Sir, today I prefer just listening to the class because I'm
Okay,
deaf now.
tomorrow. Okay, no problem. As one person here, I don't know that whether how it affect you. So no problem. I will take the class, and in between, you have any doubt or any clarification, you can ask. Okay.
Okay, sir.
Okay, so we are dealing with the cardiovascular system. Cardio means heart, vascular means blood vessel. I hope you are seeing my PowerPoint presentation. Am I right?
Yes.
Okay. Cardio means heart. Therefore, we have to consider in the CVS first heart and later a little bit of vascular system also. Okay, you see, this is our heart. Right atrium, right ventricle, left atrium, left ventricle. What's the property of right atrium and right ventricle? It's contained the blue one. Blue one means the deoxygenated blood, whereas the left atrium and okay, let me show you with the arrow mark. Left atrium and left ventricle contain oxygenated blood. In between right atrium and left ventricle, you can see our tricuspid valve, and in between left atrium and left ventricle, you can see our mitral valve. More than that, here you can see the superior vena cava, inferior vena cava draining to right atrium. Okay, that's all regarding this heart chambers and some valves. So 4 chambers are to the heart, 2 chambers are right-sided chambers, and the 2 chambers are left-sided chamber. And therefore, heart act as a double pump. Okay. Now, the function of heart is pumping the blood into all part of the body. And who supplies to this heart blood? Heart also need blood. The pumping organ is heart, but the pumping organ also need to be pumped by the blood. So that you can see these are the arteries supplying to the heart musculature. This is root of aorta. Through the aorta, the blood is going out. Root of aorta, you can see right coronary artery, left coronary artery. And the right coronary artery has several branch. Left coronary artery also has several branch. And in the previous class, I have taught the students that these are the branches of this one and this one. Now I realize that we need not to study the anatomy and physiology in detail, because if I refer question paper, they were not asking such a question. Therefore, I'm simply telling that right coronary artery to the right side, left coronary artery to left side. If you want further details, there is right marginal, posterior interventricular, left circumflex, left marginal, anterior interventricular, diagonal, just etc. Anyway, left side there is left coronary artery, right side there is right coronary artery. Accompanied with these arteries, there will be vein also. And the vein will drain to a venous chamber that drains to our right atrium. More than that, some other veins are also. Anyway, there is arterial supply called coronary vessels as well as venous supply is there for heart muscle. Okay. Now, I want to tell you about the internal structure of heart. So, what are the things I told you? The chambers, then the coronary artery, coronary vein. More than the lymphatics also there. Now the layer of the heart. You see, myocardium constitutes the major portion of heart. Myocardium is a muscle. Smooth muscles are there, skeletal muscles are there, just like cardiac muscles are there. So this cardiac muscle constitutes the greater portion. It will not. It has to work continuously without any fatigue. Therefore, it's myocardium. More than that, inner endocardium and outer epicardium. Epicardium is actually, by literal sense because the visceral pericardium is called, pericardium is the outer covering of heart. The visceral, this has parietal and visceral pericardium. The visceral pericardium is actually called epicardium. Whatever, maybe leave it, no problem. Epicardium is there, middle myocardium, inner endocardium. The thickest layer is myocardium. Everybody knows this thing. Okay. Now I am telling you about the valves of the heart. You can see what is this valve. This is actually tricuspid valve, and this is pulmonary valve. This is mitral valve. This is aortic valve. Tricuspid, pulmonary, mitral, aortic. Very simple. Now the conductive system of the heart. You can see the SA node. From the SA node, the signal, this SA node is the pacemaker. From this SA node, signals are discharging, and the discharger signal will go to AV node. From the AV node, it goes to bundle office, then right and left bundle branch, and the Purkinje fibers. SA node, AV node, bundle office, right and left bundle branch. This may be new to you. The right bundle branch and left bundle branch. Whatever may be the Purkinje system. This is the conductive system of the heart. What is this peculiarity? Every organ has to be innervated and be controlled. But the heart has its own mechanism to contract and relax. The initiation of that impulse coming from this SA node, therefore it is act as pacemaker of the heart. If the SA node is damaged, the atrial wall or AV node will take part its role, the role of SA node. They will itself act as pacemaker, or the ventricular wall even act as pacemaker. So the autonomicity is a capacity of heart muscles. Okay, anything. First of all, the first and foremost pacemaker is SA node. That does not mean if SA node is absent, autonomicity of self-controlling capacity, self-contracting capacity is lost or not. If SA node is not there, AV node will do its action. It will itself make pacemaker. So you just learned that SA node, AV node, bundle of phase, left and right of bundle branches and Purkinje fibers. Now, beside of this thing, I told you that the heart has autonomous control. But beyond that, our nerves from our brain also innervating our spinal cord, innervating our heart. They can control our heart rate. Suppose somebody is anxious, what happens? Heart rate will increase. This is due to sympathetic innervation. Suppose somebody is relaxed, what happens? The heart rate will decrease. This is due to vagal inhibition. It is due to parasympathetic system. Parasympathetic supply through vagus nerve, resulting in vagus inhibition, heart rate reduction in the heart. Whereas sympathetic, when we are alert, our heart rate will increase. That is due to sympathetic system. What I mean is that sympathetic system and parasympathetic system works opposite manner, so that in sympathetic system, due to adrenaline and noradrenaline, the heart rate will increase. Whereas in parasympathetic system, due to acetylcholine, the heart rate will decrease. Okay. Now, that's all about the basic anatomy and physiology of the heart muscles. Not muscles, heart tissue. Now, I want to tell you about the major investigation in cardiology, that is about electrocardiography. This is what ECG. Somebody asks you what is really an ECG, you have to think that it's a graph where in x-axis we represent the time and the y-axis we represent what? We represent our voltage. You can see in the ECG there is a P wave. This P wave is due to the depolarization, spread of charge over the atria. Where is atria? Here you can see the atria. Okay, atria. Whereas QRS complex is due to the spread of charge in the ventricle. Then what is T wave? T wave is actually the spread of charge, we call it as depolarization. So atrial depolarization is represented by P wave, and the QRS complexes represent the ventricular depolarization, so the spread of charge over the ventricle, and the ventricular repolarization, not D, repolarization is represented by the T wave. Then what is T wave? Is repolarization. Again, the charges become normal state. That is depolarization. Then there is a natural doubt arising that if P wave is atrial depolarization, if Q wave is ventricular depolarization and T wave is repolarization, where is atrial repolarization? The atrial repolarization comes after the P wave, but it is buried under the QRS complex. Therefore, we cannot see that. More than that, while I am telling the QRS complex, this is a Wikipedia picture. This picture only representing the QRS waves separately. You see, this yellow portion is called Q wave. You want to know that because prominent Q wave is a feature of myocardial infarction. So this is Q wave, and this is R wave, and this is S wave. They are separate waves, but generally we call it as QRS complex. Okay, then in this segment is so important. After S wave, before T wave. Again, tell me, again, I'm telling after S wave and before T wave, there is a S T segment. After S wave, before T wave, there is ST segment. That is so important, crucial in the identification of ECG, pathological event in the ECG. I will tell you that. So the PR interval is also okay. P wave, QRS complex, and T wave. That's okay. Now, you see, this is what our ECG paper. In the ECG paper, if you look, one small square represents 0.04 second. Maybe that's difficult to remember. Generally, I am telling a large square, 5 millimeter, represents 0.2 second. 0.2 second is represented by a large square. You can see a large square here containing the 1, 2, 3, 4, 5 small square. Okay, that's just like that in y-axis. 0.5 millivolt represent one large square. One small square represent 0.1 millimeter. Very simple. One small square in the y-axis is 0.1 millimeter. This is large square is 0.5 millivolt, not millimeter. I'm sorry, millivolt. Okay. More than that, in x-axis, one small square represents 0.04 second, whereas in a large 5 millimeter area represent 0.2 second, 0.2, 0.05. Okay. Anyway, this is what an ECG. This kind of ECG we call it as 12 lead ECG. Why it's called 12 lead ECG? Because it is recorded by 12 electrodes, numbering 12 electrode. I will show you the 12 electrode in this ECG. V1, V2, V3, V4, V5, V6. I mean V1 to V6. More than that, AVR, AVL, AVF, AVR, AVL, AVF. More than that, lead 1, lead 2, lead 3. Lead 1, lead 2, lead 3. 3 electrodes. Those electrodes we are placing on the chest. Okay, not lead 1, lead 2, lead 3, but usually there is chest, there will be electrode. More than that, V1 to V6. So, lead 1, lead 2, lead 3, V1 to V6, 9. AVR, AVL, AVF, plus 3, 12. This is what 12 lead electrode. We are decoding the P wave and QRS complex and T wave at 12 electrode. Based on 12 electrode, you can see 12 different kinds of ECG here. I will explain that. Okay. First of all, I want to tell you where are the these electrodes are placing. First of all, in chest region, V1, V2, V3, V4, V5, V6. 6 electrodes are placing. More than that, in the right arm, there is an electrode. Left arm, there is an electrode. Left leg, there is an electrode. I am not telling this right leg. Why? I know. I will tell that. Right arm, there is one. Left arm, there is one. Left leg, there is one. But in the right leg, this green one is earth. It is for comparison, not for recording. Therefore, here you can see one electrode. Here you can see one electrode. Here you can see one electrode. This electrode is the right limb electrode is earth. Earth. Okay. Now right leg electrode. Okay, RA, LA, LL, RL, different. They were named so much. Okay, so I want to tell you that where this RA electrode is actually needed. I will tell you that. You see, this is a triangle. This is actually Eindhoven's triangle and everything. People telling so. Anyway, our topic is not physiology. Okay, you see, here you can see that our electrode. This right arm electrode represent right shoulder region. Here, this left arm electrode represent this shoulder region. This left lower limb, left leg region represent this abdominal region. So this corner of triangle goes to here. This corner of triangle goes to here. And this corner of triangle goes to left leg. And this is ground electrode. Okay. This uh, right arm or right shoulder electrode represented by AVR. What is AVR? This right-sided electrode. Right-sided electrode is actually placing in the limb, hand, leg, I mean upper limb, right upper limb. But the thing is that it is representing the right shoulder and it is represented by AVR, augmented vector right, the right leg. Just like that, this is augmented vector left. This is augmented vector foot. Only one foot is there, so one foot is calculating, but so that AVF, AVL, and AVR. So now you understood how the electrode AVR and AVL and AVF comes. Augmented vector means the electric discharge from the heart to reaching to this electrode is augmented, is exaggerated, so that we can clearly record the ECG. So this is a augmented, increased vector right. Vector means our electrical discharge vector. Okay, and a repolarization vector. Augmented vector right, augmented vector left, augmented vector foot. Okay, more than that, this is the ground electrode. Now, where is the lead one in between these two electrode? Lead one, lead two in between these two electrode, lead three in between these two electrode. That need further clarification. I will show you that. You see, this is AVR. This is AVL. In between AVR and AVL means this is AVR, this is AVL. You can place a galvanometer in between AVR and AVL. This is lead 1. The potential difference between AVR and AVL is lead 1. The potential difference between AVR and AVF is the lead 2. The potential difference recorded using a galvanometer between AVF and AVL is lead 3. Here lead 1, lead 2, lead 3. Now you got a clarification. What are the leads? V1 to V6 just lead. AVR, AVL, AVF augmented leads. In between that, these three lead, there is lead 1, lead 2, lead 3. Actually, the potential difference between these three leads. That's okay. Now, that's all about the ECG. Now, I want to teach you how we calculate the ECG. How we calculate, I mean, what are the findings we have to get from the ECG. Okay, for that, you can see the, just wait, heart rate. How will you find the heart rate from the ECG? Of course, there it will be in the printed manner. But the thing is that 300 by number of large square in between RR interval. You see, this is R wave. This is in R wave. In between R and R, actually this rose is one ECG. This blue is another ECG. This color is another. This is another. This yellow is another. You look at this thing. This is 1 R, 1 R. In between R, how many large square? Large square, 1. So 300 by 1. The heart rate is 300. This is one R wave. This is one R wave. In between, there is two large square. One is this thing. One is this thing. So 300 by 2. That is 150 is the heart rate. Here you can see 3 large square. So 300 by 3. 100 is the heart rate. 100 beats per minute. Here you can see 4 large square. So that 300 by 4, 75 beats per minute. Here you can see 1, 2, 3, 4, 5. 300 by 5. That means 300 by 5 means 60 beats per minute. This is how we are calculating the heart rate when you get a ECG. Now, I want to tell you is that based on heart rate, different kinds of tachycardias are there. Okay, normal heart rate is 60 to 100 beats per minute. In lower class, we may heard about that it is 72 beats per minute. 72 beats per minute is an average value obtaining from 60 to 100. Anything below 100, we call it as tachycardia, and below 60 we call it as bradycardia. Now, if the atrial rate is, remember atrial rate is not the pulse rate. It is the ventricular rate. Left ventricular rate is actually the pulse rate. Atrial rate is obtained basically from the ECG. Okay, if the atrial rate is around 200, beyond 100, it's tachycardia, atrial tachycardia. I'm telling it is not the ventricular tachycardia I'm talking. It is not the pulse rate I am talking. I'm talking you about the atrial tachycardia obtained from ECG. Okay, so if the atrial rate is more than 200, around more than 200, it is paroxysmal tachycardia, paroxysmal atrial tachycardia. There is normal atrial tachycardia beyond 100. When it's beyond 200, paroxysmal tachycardia. When beyond around 300, we call it as atrial flutter, and beyond 350, we call it as atrial fibrillation. Don't worry, we are in detailed manner, we are studying all these terms. First of all, 60 to 100 beats per minute is the normal thing. More than 200, paroxysmal tachycardia. This is not normal, paroxysmal tachycardia. Around more than 300, atrial flutter, and above 350, it's atrial fibrillation. We will study what is atrial fibrillation, what is atrial flutter, what is paroxysmal tachycardia, and normal, more than what is the normal tachycardia, and what will be the normal heart rate. Remember, heart rate normal is 60 to 100 beats per minute. Okay. Now, that's all about heart rate. What other things we studied in heart rate? How we find the heart rate using ECG. Second thing, atrial tachycardia. What are the different kinds of atrial tachycardia? There is atrial fibrillation more than 350 to 600. There is atrial flutter around 300. That means 250 to 350. There is atrial paroxysmal tachycardia around 200. That means 150 to 250. Okay, there is normal heart rate, that is 60 to 100 beats per minute. Don't worry, we will study all these things later. Now you see rhythm. Rate after rate, rhythm. When you want to know the rhythm, you look at the RR interval. You can see in this ECG, this RR interval, R wave is regularly appearing. Therefore, it is a regular heart rhythm. That's normal. But it can be irregular. In this ECG, you can see irregular R wave. Irregular R wave can be repeated in a regular manner. The irregularity in the R wave can be repeated in a regular manner. Then it is called regularly irregular. Sometimes the irregularity in a manner that no relation between any irregularity. That is irregularly irregular. So why I am telling this, that the pulse rate will be irregularly irregular in atrial fibrillation. Just like that, regular R wave, I tell you the rhythm is regular. Sometimes the irregularity will be there, but that irregularity repeat and repeat and repeat again. Suppose a narrow RR interval, now broad RR interval. Again, narrow RR interval, broad. Then narrow, broad. That is means a irregularity is there, but it is regular. That is what regularly irregular. Otherwise, we call it as irregularly irregular. So I want to repeat that. In atrial fibrillation, I will teach you what is atrial fibrillation. The pulse rate will be irregularly irregular. We cannot find any relation. Not only it is not regular, but also there is no regularity in the irregularity also. That means irregularly irregular. But I want to tell you that in studies, you should not be irregularly irregular. Okay, daily you have to study all these things. Now you see regular RR interval tracing the ECG, irregular RR interval vary tracing on ECG, irregularly irregular and regularly irregular. Okay. Now next thing. Sometimes while talking you about a rhythm, normal sinus rhythm, such a term may be there. Normal sinus rhythm. The normal sinus rhythm means heart rate simply 60 to 100. More than that, P wave should precede the QRS as usual. More than that, P wave should be positive in lead 1 and AVF. Lead 1 means between AVR and AVL and the AVF. In AVF and between AVR and AVL, we call it lead 1. Lead 1 and AVF, the P wave axis should be normal. P wave axis should be normal means it should be positive like this as usual. So this is a normal condition. We are studying in the ECG, this normal condition. Heart rate between 60 to 100. I'm teaching what is normal, what do you mean by normal sinus rhythm. Normal sinus rhythm means 60 to 100 beats per minute heart rate. P wave should proceed QRS complex. Positive P wave in AVL, between AVR and AVL, we call lead 1 and AVF. That is what positive P wave in lead 1 and AVF. More than that, P wave should proceed QRS. The rate should be in between 60 to 100. This is the three criteria to satisfy normal sinus rhythm. Okay. Now, after completing the rate rhythm, I want to tell you about cardiac axis. I told you that we are recording the repolarization wave. The electricity wave is a vector quantity in different direction. Here you can record the AVR. Here you can record the AVL. Here you can record the AVF. More than that, you will record lead 1, you will record lead 2, you record lead 3, then V1, V2, you see the red vectors. These are all different vectors recorded by our V1, V2, V3, V4, etc. electrodes. So at different direction, the different angle and magnitude will be there for our electrical vector. You know the vector quantity, it's mathematics. Okay. Anyway, I want to simply tell you is that different direction there will be different magnitude and electric charge will be there. Electric charge is spreading all over the body. That is recorded by electrode at different places. So what will be the sum of all these vectors and the direction? The sum of all these vectors, we call it as cardiac axis. Sum of all these vectors, we call it as cardiac axis. You see, here you can see the minus 30 and plus 90, actually not 100. In between, the sum of all these vectors, the cardiac axis, sum of all these vectors of electrical charges should be in between minus 30 to plus 90. If it is not in between minus 30, the sum of all electrical charge vectors should be in between minus 30 and plus 90 vector. If it is not in between minus 30 plus 90 vector, that means there is axis deviation to the heart. That means heart muscle has hypertrophied. That may result in heart muscle hypertrophy may result in left axis deviation or right axis deviation. I will show you with, the sum of electrical vectors of depolarization wave in different direction. Electrical vector may be in different direction, magnitude and direction. Its sum is called what? Mean axis. Normal axis will lies in minus 30 to plus 90. You can see here, this is minus 90, this is plus 90. In between minus 90 and plus 90, the axis should, you can see the mean axis, mean electrical axis. This green one is the sum of all the vector. That should lies in between minus 30 to plus 90. If it is outside the minus 30, or it is beyond plus 90, we will call it as hypertrophy. I mean axis deviation. You see, you can see left axis deviation means less than, left axis less than, left axis mediation less than minus 30 axis. Right axis deviation means more than plus 90 axis. You see, this is minus 30. When it is here in this region, it is left axis deviation. This is plus 90. When the resultant vector, this green vector lies here, it is right axis deviation. Less than minus 30, it is left axis deviation. More than plus 90, we call it as the mean axis more than plus 90 region, we call it as right axis deviation. This left and right axis deviation is the hypertrophy of heart muscle. Okay. Simply, heart axis lies between minus 30 to plus 90. Anything beyond this or below that, I want to tell you that it's axis deviation. This left axis deviation and right axis deviation takes place during hypertrophy of heart muscle. Okay. The reason for hypertrophy may vary. I will teach you later. Now, the most important finding in the ECG I want to tell you. The most important finding in the ECG is actually ischemia or infraction. Ischemia or infraction. Okay.